USMLE style question. A 29-year-old man presents with abdominal pain, chronic diarrhea, and weight loss over the past 2 years. He also reports recurrent perianal pain and drainage. Physical examination reveals a low-grade fever, right lower quadrant tenderness, and a perianal fistula with purulent discharge. Laboratory findings include hemoglobin, 10.5 Krg low, mean corpuscular volume, MCV, white blood cell count, 12,500 mmHg, elevated, C-reactive protein, CRP, elevated, fecal calprotectin, elevated. Colonoscopy reveals skip lesions, cobblestone mucosa, and deep ulcers. A biopsy of the affected area shows non-caseating granulomas. Which of the following best explains this patient's perianal symptoms? A. Ischemic injury to the colonic mucosa. B. Mucosal inflammation limited to the colon. C. Transmural inflammation leading to fistula formation. D. Vascular malformation in the gastrointestinal tract. E. Viral infection of the anorectal region. Answer and explanation? Correct answer. C. Transmural inflammation leading to fistula formation. This patient has Crohn disease, a chronic inflammatory bowel disease characterized by transmural inflammation, which can lead to complications such as fistula formation. The deep ulcers and transmural involvement allow for abnormal connections between different parts of the bowel, skin, or other organs. Key features of Crohn disease: pathophysiology, chronic inflammation, transmural involvement, leads to fistulas, strictures, and abscesses. Symptoms: diarrhea, often non-bloody, abdominal pain, commonly RLQ, perianal disease, fistulas, abscesses, anal fissures. Colonoscopy findings: skip lesions, patchy involvement, cobblestone mucosa, deep linear ulcers. Histology: non-caseating granulomas. Complications: fistulas, enterocutaneous, enteroenteric, enterovesical, perianal. Strictures, leading to bowel obstruction. Malabsorption, B12 fat-soluble vitamins. Treatment, steroids, immunosuppressants, azathioprine. Biologics, TNF inhibitors like infliximab, adalimumab. Antibiotics, metronidazole, ciprofloxacin for perianal disease. Why not the other choices? A. Ischemic injury to the colonic mucosa seen in ischemic colitis, which causes sudden onset pain and bloody diarrhea in older adults with vascular disease. B. Mucosal inflammation limited to the colon, describes ulcerative colitis, which has continuous colonic involvement, superficial mucosal inflammation, and no fistulas. D. Vascular malformation in the gastrointestinal tract, refers to angiodysplasia, which presents with painless GI bleeding, but does not cause transmural inflammation or fistulas. E. Viral infection of the anorectal region, could describe HSV or HPV, which cause painful ulcers or warts, but not deep intestinal inflammation or fistulas. Takeaway: Crohn disease causes transmural inflammation, which can lead to fistula formation. Patients may develop perianal fistulas, abscesses, or enteroenteric fistulas, contributing to persistent symptoms and complications. Biologics, TNF inhibitors, are key in management, especially for fistulizing disease.